Dr. Cosgrove, let's hear from you.
Well, thank you very much. First of all, I'd like to thank you, Senator, and Senator Portman for taking the initiative of this. I think it's a great initiative, and we're very supportive of it. We really started about 7 years ago when I stopped to think about the fact that maybe we should move from being involved in sick care to wellness, to health care. One of my first moves was to create a chief wellness officer, which was Mike Roizen. And we started out by looking at smoking and obesity and changing foods in the institution. And over time, we realized that we continued to have an escalating cost of our health care. And so 2 years ago, we began to say, how can we begin to change this? And 2 years ago, we instituted a plan looking after patients who had chronic diseases. And so what we did is we picked out 6, particularly that we would incent people to enter into disease management. And those 6 were diabetes, asthma, smoking, obesity, hypertension, and hypercholesterol. Gradually what we did is we said, let's, each year, we will rebate the increase in what they have to pay for their health insurance if they enter into disease management. We started out with about 13% of people being in disease management. Even our diabetics, only 13% of those were in some sort of disease management. And so we gradually, as we added incentives to them to do this, we saw the numbers increase, and now 50% of people with chronic diseases in our 40,000 employees are in some sort of disease management. With that, we began to see an interesting thing. For the first time, we began to change the slope of the inflation of our healthcare costs. Our healthcare costs are around $300 million annually for the organization, and we began to see that those lines change in a flattening of the curve and a different sort of curve of inflation. And in fact, our inflation rate the first year was a fraction of 1%, and the next year it was 4%, which was about half of what the national average and what it had been previously. Also, we began to say, well, can we attribute these changes in the cost to what we're doing? And what we saw was in the people who had chronic disease who were in a management program, we saw their hospitalizations go down for their diabetics. We saw the costs go down for the diabetics while the rest of the people who were not managed continued at a regular higher rate of inflation. So we do think that carrots and encouraging people to get into disease management really makes a difference for them. And we have seen an increasingly healthy population. We've seen people begin to enter into the exercise programs. And I get hugs all the time from people who want to thank me for helping them stop smoking. It has been probably one of the most gratifying things we've done, both from the standpoint of the health of the individuals and also from the fact that we have wound up saving money from it. So it's been a very successful program for us, and I think that it has an opportunity to be rolled out in a much bigger way across the country.
Great start. Doctor.